Surgical technique of diamond uncemented hip replacement system. Femoral head resection. In this step, neck resection guide, femoral head extractor, and oscillating saw will be used. Elevate the proximal femur and align the neck resection guide down the long axis of the femur. Determine the resection level by aligning the top of the guide with the tip of the great trochanter or by referencing a measured resection level above the lesser trochanter. Mark the resection line using electrocautery or methylene blue. Resect the femoral head. If desired, make a conservative neck resection initially. The Kelser planer may be used later to adjust the neck cut. If necessary, use femoral head extractor to remove the femoral head. Acetabular preparation. In this step, acetabulum retractor, acetabular reamer handle, acetabular reamer, trial acetabular shell, trial acetabular liner, screwdriver for trial, and acetabular cup positioner will be used. Make sure the acetabulum is fully exposed and remove soft tissue from the acetabular rim. Progressively ream the acetabulum in angle around 45 degrees of abduction and 15 to 30 degrees of anteversion. When necessary, change to reamer with larger size. Continue to ream until healthy subchondral bone is reached and a hemispherical dome is achieved. Unscrew the acetabular shell liner assembly. Using the shell positioner, place a trial acetabular shell into the reamed acetabulum and assess its position and cortical bone contact. The inferior rim of the trial shell should be level with the bottom of the teardrop. The trial shell angle of orientation should match that recorded during preoperative templating, which is normally 45 degrees of abduction and 15 to 30 degrees of anteversion. Remove the shell positioner from the trial shell. Place the desired liner trial into the shell trial. Please note to place the thicker part of liner trial in posterior acetabulum. For left leg, it is around 1 o'clock direction, and for right leg, it is around 11 o'clock. Femoral preparation. In this step, we will use box osteotome, tapered canal probe, and trochanteric reamer. Use a box osteotome to enter the femoral canal at the junction of the femoral neck and the greater trochanter. Utilize the tapered canal probe attached to the T-handle to establish a direct pathway to the medullary canal. Advance the canal probe to where the superior margin of the cutting flutes meets the neck resection. The canal probe should pass easily if proper alignment has been achieved. It is important to have circumferential clearance with the canal probe to avoid reaming in a varus orientation. The path established by the canal probe will dictate the route for the optional trochanteric reamer, tapered reamers, and broaches. Take caution to ensure neutral alignment of the canal probe. To aid neutral stem alignment, the optional trochanteric reamer may be used to lateralize the proximal entry point for the subsequent tapered reamers and broaches. Attach the trochanteric reamer to the T-handle or a power reamer and insert it into the canal. Advance the trochanteric reamer until the cutting edge of the reamer is aligned with the greater trochanter. Direct the cutting region of the reamer laterally into the greater trochanter to widen the canal entry point. Tapered reaming. For tapered reaming, taper reamers with 5 different sizes will be used. Each reamer has dual depth calibration lines for each of 2 stem sizes. Use tapered conical reamers to prepare the distal femur. Sequential reaming beginning 2 or 3 sizes below the preoperatively templated size is recommended. Based on either referencing line, change to reamer 1 size larger. Resistance and chatter from cortical engagement may be used as a signal to cease tapered reaming. Each reamer has dual depth calibration lines for each of 2 stem sizes, located distally for calcer references and proximally for greater trochanteric referencing. The choice is based on the surgeon's preference and intraoperative situation. If necessary, medullary cavity trimming reamer can be used to trim the cavity. Femoral broaching. For uncemented hip system, there is 1 broach for every implant size. Broaching of the proximal femur should begin 2 to 3 sizes smaller than the preoperatively templated size, corresponding with the referencing lines of tapered reamer. Attach the appropriate broach to the broach handle. To ensure proper broach alignment, orient the broach laterally toward the greater trochanter. Ensure that any remaining superior lateral femoral neck remnants are cleared to avoid malalignment. Sequentially advance the broaches down the medullary canal, ensuring proper alignment and anteversion are achieved. The final broach should fit and fill the proximal femur, with the top of the cutting teeth resting at the point of the desired neck resection. The final broach should feel rotationally stable. Calcer planing and trial reduction. In this step, we will use calcer planer trial necks with trial heads. Uncemented stems are collarless designs. Therefore, calcer planing is optional. Attach planer to the power reamer. Place the planer over the broach stud and mill the calcer to the broach face. Make certain the planer is rotating before engaging the calcer. This will prevent the planer from binding on the calcer. Trial neck segments and trial modular heads are available to assess proper component position, joint stability, range of motion, and leg length. Perform reductions to check and determine the appropriate size of femoral head prosthesis. Remove the trial acetabular components and implant the desired acetabular shell prosthesis. Take care to ensure cup orientation mimics the orientation of the trial component. Acetabular screw insertion. Acetabular screw insertion is optional, based on surgeon's preference and intraoperative situation. Soft drill, drill guide, depth gauge, screw holder, and polyaxial screwdriver will be used in this step. Drill in the selected screw hole with 3.2 mm soft drill. Use depth gauge to determine the screw length. Insert and tighten acetabular screw with appropriate length, with polyaxial screwdriver and screw holder. Using acetabular liner positioner, implant the acetabular liner prosthesis onto acetabular shell prosthesis. Make sure acetabular liner seats firmly on acetabular shell. Stem and head insertion. Connect hip-appropriate size stem with stem inserter. After the final acetabular shell is in place, introduce the hip stem to the medullary canal. Rotate the stem into its proper orientation and advance the stem into the cell using hand pressure. The implant should meet resistance 10 to 15 millimeters above the desired final seating position. Advance the stem into position with moderate blows from the mallet. The implant is fully seated when the top of the coating area is at the level of the top of the broach teeth and the implant is stable. Clean and dry the stem taper. Manually introduce the appropriate femoral head by firmly pushing and twisting the femoral head into place on the taper. Using the head impactor, engage the head with several mallet taps. Perform a final reduction to check the implant stability and leg length.